He's presenting a complete misinterpretation of old information that is counter to all of the science. And having a fever during pregnancy can be detrimental to the unborn child. It can cause a miscarriage. It can cause premature birth.
Dr. Frita, appreciate you joining us. Can you tell us what happened today? Because Donald Trump touted this yesterday. He said, we have an announcement to make as it relates to autism. We believe that we've wiped it out or something. I'm paraphrasing, but we'll see. We think we're very close. And then he gets to the press conference today and he says, well, we don't know. We'll see. We think it's all there. We're not sure. But basically, to me, and you tell me if I'm wrong, it sounds like he is announcing, along with RFK and Dr. Oz, what would you call it? I don't know, misinformation about Tylenol and autism that has been said before, but is not proven to be true. Maybe I'm wrong. You tell me.
He's presenting a complete misinterpretation of old information that is counter to all of the science, which is why I have been practically in a clinical depression. So I wish I would have had Godfrey, Francesca, and everyone else before, because laughter is medicine.
The FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol.
And
they said black women have brain processing power.
That was pretty good. Wasn't it? I did very well. It says here that this new medicine is called. I said, well, oh wow, this is tough. I'm a very good reader. Hold on. This is supercalifragilisticexpialidocious. So Tylenol.
Of course, laughter is medicine, but this is so serious and so heavy because they're going back and cherry picking data. And bottom line, they are suggesting that there is a causation between Tylenol or acetaminophen and pregnant mothers. There's, suggesting that it could cause autism, when honestly, we've had decades of studies to counter it. And just to give you one study, in 2024, there was a huge study published in JAMA, which is a very reputable medical journal. And we did a combination with Sweden. We looked at 2 million children born in Sweden between 1995 and 2019. Of those children born, 185,000 of their mothers used Tylenol while they were pregnant. They went through and analyzed this data very carefully. They looked at siblings of the babies. They looked at the moms who didn't use Tylenol, and there was no causation between the Tylenol or acetaminophen and autism. And there are many, many other studies to show that. And so for them to present this, it's dangerous, Don, because Tylenol is actually, according to the Society of Maternal Fetal Medicine, it's actually the safest pain reducer and fever reducer for pregnant moms. And having a fever during pregnancy can be detrimental to the unborn child. It can cause a miscarriage. It can cause premature birth if you have an untreated fever during pregnancy. It can cause hypertension in the mom. It can cause all kinds of problems. And so what we know is that when there is confusion coming from the top, moms, parents tend to do nothing. So imagine if now you have all of these confused mothers who would rather have a fever, which is scientifically proven to be potentially detrimental to children. They'll sit there and have a fever and suffer, as opposed to taking Tylenol during pregnancy, when honestly, this data that's being presented is misinterpreted, incorrect, and quite frankly, it's dangerous to our country. I'm really ashamed in this moment.
I was going to say, my question is an obvious one. Why? Why make this announcement? Why do this and put lives in danger?
It's really...
Do you agree that lives are in danger?
Lives are 100% in danger. Okay. They're 100%. And it's not just isolated. It's not just about this announcement. Everything is starting to add up. I'm still sitting here trying to get over last Friday's debacle when RFK Jr.'s advisory committee on immunization practices did a complete reversal from Thursday to Friday. And their announcement was that the measles, mumps, rubella, chickenpox vaccine, first they said it would be approved by the government, paid for by government insurance, parents could request it. And then in just 24 hours, they changed and they say now that that MMRV vaccine is no longer recommended and it won't be covered by insurance. So it's a buildup of confusion. It's a buildup of confusion. And so, yes, lives are in danger, not just because of the Tylenol and the pregnant moms, but because when you cannot trust what used to be the most reputable scientific brain power organization in the world, arguably, when you can't trust that, what do? It leads to inaction. It leads to people going and finding other unscientific measures to treat diseases. You don't know what to believe. And when you have confusion, when you have chaos, you have disease and you have death. So this is dangerous. I do want to say that I applaud the organizations like the American Academy of Pediatrics, which boycotted RFK Jr.'s ACIP meeting. I applaud the Society of Maternal Fetal Medicine. They came out and made a statement against what Donald Trump's announcement was about Tylenol and pregnant moms. I applaud the American College of Obstetrics and Gynecology. So one of their chief leaders came out and made a statement against what Donald Trump announced as well. So it's really showing us that this is not about the right or the left. The scientists are coming up. The evidence-based physicians are coming together. And that should let us know that when people jump out of their aisles and just go to the science, go to the evidence, it's serious. And the scientists, the physicians, we all know what will happen if we have a society that is not based in evidence. It will lead to disease. It will lead to death. And the ones who will suffer first will be the low-income families, largely Black people, brown people, people in rural areas, a lot of supporters of this current administration who have low income, okay? They may not realize it. This will affect them first, because I can guarantee you that the billionaires, the privileged people, the ones who truly do understand that the science matters, their children will be getting vaccines. Their pregnant wives will be taking Tylenol. So really, this is something that is just unbelievable. And I'm really trusting. I'm an optimist, Don. I'm still an optimist. I'm really hoping that the science and the evidence will prevail.
So then what do you say? We want to save lives and give people the correct information. What do you say to folks out there watching? What would you suggest they do in this moment?
I suggest that you consult with your OBGYN if you are a pregnant mom, or if you're someone who is looking to become pregnant. You consult with the pediatrician you trust. You look at organizations like the American Academy of Pediatrics, American Medical Association, National Medical Association, Georgia State Medical Association. You look at the organizations that haven't failed you, the organizations that have been founded in evidence, science, those of us who really take our oaths seriously. First, do no harm, because the evidence isn't changing, okay? The true scientists, the medical doctors, and allow me to remind y'all that RFK Jr. is not an MD, he's not a scientist. And I was on one show, Don, talking about like the decision that was made by the ACIP. And the journalist said, well, the good news is that the final decision will be, by the director of the CDC. Well, we all know that what appears to be a qualified director, Dr. Susan Menares, was unceremoniously fired. And the replacement director is not an MD, does not have an advanced degree in public health. And so that's not really a sobering thought. So please look to your physicians you trust, look at the organizations that have been tried and true. And, hopefully we will come together, and the decision makers in DC, hopefully they will make some votes and make some decisions and really put the proper qualified people in these positions at some point.
So Dr. Frita, thank you. I want you to stand by, because Dr. Frita, this is such an important thing. Dr. Frita is going to join us on our members only, right? On our private live stream in just moments. If you're a member, if you're a Lemon Head or a Lemon Legend, you get to join us. You get to tell us about your take on the news. You can say whatever you want. And then I'm sure they have some questions for Dr. Frita. Dr. Frita is a triple board certified medical doctor with certifications in nephrology, hypertension, and diabetes. She's also the host of the Dr. Frita YouTube channel, which is a very popular show, over 1 million followers and subscribers there. So, Doctor, thank you. We'll see you in just moments on the members only show. That's what you get. If you're a member at a certain tier, you actually get to be a part of the show. Okay. So we'll see Dr. Frita in just moments. I want to tell you guys, if you're watching and you want to know more about the show, all you have to do is go to donlemon.com. You can find out anything you want about the show, donlemon.com.